Let's also order the REMAC meeting. First up is approval of the minutes from way back in November. January, sorry, I'm looking at the oh, that's okay.
Spend enough time in the office to get them right.
Any additions, corrections, solutions? All those in favor? Aye. Do we have a quorum?
We have a quorum, yes, we do.
All right.
Position quorum, yes.
Good. Before we do any new business, let me introduce from St. Mary's.
Dr. Thomas Adirondack-Appalachian from St. Mary's Hospital Emergency Department. Welcome.
Nice to meet you.
Welcome. New business, approval of new medical directors for South Cartwright and Sydney Center. These are the appropriate sign your life away State Department of Health forms. They look appropriate. Sydney Center and Cartwright Rural Emergency Squad both have medical directors per protocol. So that's really just informational. I guess we should approve them. So I know both these individuals are both active emergency physicians. Any motion to approve? So moved. All those in favor?
Aye.
Aye. Thank you. Next item is a question from probably Phil.
Yes, we have, I'm going to, in turn, I'm going to boot that over to Mary. Is Mary here?
She just stepped
Oh,
out.
okay, well, Joe is going to have to fill it by default then. The process for AAREMS agencies, and AAREMS to be approved to enter the BLS CPAP program, I'm not sure if Bob Stuber at Finger Lakes is still the man as far as the head man for that program.
We're going to have this one. That's
Okay.
All right, we can, well,
Mary didn't think he was, and failing that, then AAREMS should have a little process in place. The physician should have a little process.
should we come back to that item on Mary's in the room?
Sure.
All right, so we'll keep going. Approval of Oneonta State Emergency Squad to begin intranasal naloxone.
They have finished their training, and they're just awaiting our approval. Their medical director is fully on board.
Okay, is there a form that gets added to the repertoire?
Just a letter, we add them to the roster, we make a notation on it next to the agency.
When this program first came out, I thought, are you kidding me? Like, intranasal naloxone up in, mountain lakes. You gotta be kidding me. It turns out that it was very prescient of Dr. Daly to sort of push this upstate, because now we have, I don't know how many overdoses you guys are seeing, but heroin is alive and well. And
We look forward to the summer with trepidation up our way, because the bath salts was skyrocketing, but now the heroin is available cheaper than marijuana.
Yeah.
And they're cutting it with fentanyl in some cases, which is kind of interesting, because we got to jump through all kinds of hoops to get fentanyl, but apparently they don't when they want to cut heroin with it.
Well, even Suboxone, which was floated as some kind of methadone-like drug in terms of its use, is out there as a drug of abuse. All right. Controlled substance operating plans received from Richmondville, Milford, Evanston.
I have those plans here. They follow the templates and are signed off on by their agency medical directors. It is not necessary, according to the state regulations, that the REMAC give approval to these, but we always, when we receive them in the mail from an agency, we always present them to REMAC just pro forma.
Okay.
And I have them right here.
They all look in order.
Hmm?
So they all look in order?
Oh, they very much so.
So
yeah.
Relative to Richmondville, is the physician and medical director, Dr.
Costa, yeah. Oh, yes, he's very much on board with it.
Okay. All right, so that's informational.
Yeah.
Sharon Springs now operating BLS, informational.
Yeah, we received a letter from them just last week that we no longer have any ALS personnel available.
What's the nearest responding ALS to Sharon Springs?
I'm not really sure.
They have the ALS, they have the Flycar.
They have the Skyry County
So
Flycar.
it comes out of the county.
If it's in service.
Most of the time I think it is, isn't it? No, not anymore?
There's some gaps in coverage. Rural Metro is usually covering it when they're not.
Is there a plan from Sharon Springs to get ALS, they're just gonna default to the county. I think it'd be
Lots of times
interesting-
they go into Cooperstown and they can get a ALS intercept from that way. They go into Cooperstown lots.
See, if we were smart as a system, when a system stops doing ALS, we would look at ALS calls originating from that area and say, is there a need for ALS? You know what I mean? Like, what's the response time for
Yeah.
ALS? Do the police carry AEDs in Sharon Springs? They don't have a police force, do they?
Sharon Springs
No.
doesn't have a police force, this is Sheriff.
Not that I know of.
Sheriff's Patrol and State Police.
Yes, we want to start monitoring all calls in Sharon Springs.
Okay.
Just FYI.
As a QI,
That's bottom three of the controlled substance plan that we just talked about. And this top one is the application from Racket Lake
Just a half, Jeff.
to resume ALS service. I'll talk about that in a minute.
so is there a place where the physician sign?
Yeah, later on. Later on, we'll go around. Oh.
Just confirm that there's a signature.
Yeah, let me take it. You can see that, there's one sort of signature there. I know there's a flurry of emails between Adirondack and him, but probably works on Racket Lake.
I'll just keep an eye on the Sharon Springs PCRs and see what we have as far as ALS stuff.
She's gonna sign? Oh, to get the forms. All right, well, when we're exploring that, we'll move on. Primary operating care newly defined for Summit and Stafford.
Yeah, we're going to be talking about that during the AAREMS meeting also. I just mentioned it informationally. Summit and Stanford have had their operating territories somewhat constricted by the Department of Health because of the municipal law, because they are municipally owned agencies, and they can provide service. They cannot provide service outside the boundaries of their territory without some kind of a memorandum of understanding or a contract in place. And apparently there was no such, so Dan Clayton advised them both that this past month that they now have restricted operating territories.
So you want to bring that up under executive?
No, not really. It's
No.
it's not a QI
Okay.
problem. So it's just
So does it create areas that have nobody?
I'm sorry.
Does it create new areas without coverage?
I believe that it does create areas where there is a there was a problem for coverage. I won't say there's no coverage because you've got the flight cars there, and you have rural metro, which I believe is licensed for all of Scary County, if I'm not mistaken.
All right, that's really informational as well. Racket Lake application, I think we've got that.
Yeah, Racket Lake application to resume paramedic level of service is only submitted simply because they, as you remember, we had a CON with Racket Lake. They left the fire department under mutual agreement. They left the fire department and are operating as a standalone nonprofit corporation right now. So that means they just had to redo their paperwork. They already have been granted ALS level of service, paramedic level of service in mid-state, and he just submitted the paperwork to us now for approval of the REMAC here. It's certainly complete. We went back and forth via email a number of times to get all the T's crossed and I's dotted.
Okay. So, all those in favor of them resuming, I don't think we really need approval, right? They already had it.
Right, this is just resuming.
All right. So the last item, two last items. Ways to increase electronic availability of the protocols.
Well, I had a request from the Cooperstown Fire Department Emergency Squad saying that is there some way we can make the Department of Health statewide BLS protocols available on iPads and Androids and all that good stuff. I said I was going to look into it. I spoke with our IT guy, I said, can you make an app out of these protocols? He says, I don't know how. That's a great honest admission.
Phil, there's any number of third-party apps that contain New York State BLS protocols.
Are there really?
Yeah.
Okay.
Yeah. Aside from our own app, which contains the BLS, our BLS protocol.
Yeah, you're talking about the collaborative now.
Yeah.
Yeah, no, this is just strictly the statewide BLS.
Yeah, there's a number of third-party apps, I think, that have it.
Fantastic. All right, I'll butt heads with you then. I'm butt heads, but I'll join minds with you. I'll mind meld with you at lunchtime. Great.
But Howard-
As it is, our IT guy is working on putting something together so that they can be easily downloaded into a handheld device in a PDF format, or even a PowerPoint.
That would work
format.
too, yeah. Yeah.
Okay, I'll talk to you about this.
Phil,
Yeah.
last month at Remo's meeting, we discussed the same thing, and the question arose a little bit differently. The question arose out of actually a CIC audit that I did in Cooperstown, because the CIC intern asked, where do I find an updated version of the state BLS protocols? And the answer is, you really don't find a complete version. So the apps that are out there, be really careful with, because
Yeah,
they're not sanctioned by either a region or the state, and there's somebody who just kind of piecemealed stuff together. The suggestion that came out of the REMAC, out of Remo, was that if we truly have collaborative protocols now, we're talking about, what, 7 regions?
I think it's up to 7.
And there's an app already that's put together, at least for Apple users, for that protocol set. Why not just try and incorporate the BLS protocols into the update for January 15 and just put it all in the same spot?
The problem is on the state website, and I did a little research on this, on the state website you have the statewide BLS protocols, and then you've got 2 updates to the statewide BLS protocols.
Right.
Which are numbered, page numbers that are supposed to replace the page numbers in the original protocol book.
And then you have policies that have been added on after that that would need to be reflected within that. So I'm just saying, if we're going to redo the protocols anyhow, it was suggested that we put it all together, put the BLS in with the ALS, and put it all in one spot. Why create 2 or 3 different apps when we can just do one?
Right. Okay, the next question then is, how does one do that?
It sounds like Remo has already started that through the protocol committee for the collaborative region.
Have they?
So I would say follow up with Dr. Daly and see if he's willing to take on or
I'll mention this
delegate.
afternoon, but Tim Miraboli from Remo sent me an email last week asking would we be interested in contributing, along with the other regions that subscribe to the collaborative protocols, would be interested in contributing to software development so that the collaborative protocols will be available in Android format. They're not currently available in Android format.
Correct. Dr. Daly has an iPhone.
I hear he's an Apple. He said it would cost, Tim Miraboli, he said it would cost about $6,000 to turn the collaborative protocols into Android format. That's a hefty sum. But
I would think if split across 7 regions, that should be manageable.
I made the executive decision to say yes, we would be very interested in that, because actually this cost-saving measure for us. It's certainly going to cut back on our printing costs.
Correct.
Considerably.
Did any of the other regions contribute to the protocol book printing? I mean, originally the 3 initially did.
That's all. That's all it has. Nobody else has contributed to the protocol.
Maybe the other 4 regions should pick up the cost of.
I think when they printed their own, though, they paid for their own.
Did they?
They provided.
they didn't-
we
they
didn't
didn't.
provide free books.
Oh, all right.
The money the product we paid for is strictly kept between Remo Novelation and ourselves. That printing.
So Mary, the state's not poised to put out the BLS protocols in
We
Android.
we tell instructors when they call up asking, give them access to the website and have the students print their own. That's for any of the manuals.
Okay.
There is a little confusion. Now, my IT guy told me that the 2 updates to the BLS protocols, the statewide BLS protocols, there are 2, like I said, 2 update files on the state website, that he can take those and replace the pages in the original, which is marvelous. I have no idea how to do that, because it's a full PDF. But he said he could do that, and then let me take a look at it. And he could definitely make the, right now, make the BLS protocols available in a PowerPoint format that anybody could click into with their handheld devices, their various smart devices, whatever they are. Anyway, that's where we stand on it right now, and that all developed in the time since I printed the agenda up. That all developed yesterday afternoon. So anyway, I will chat with Steve at lunchtime, and we'll talk more about it at the AAREMS meeting.
I think the idea of making it holistic with the ALS protocols is just one place to find them all for the region.
Oh, it makes a lot of sense to find them in just one place, yeah.
All right, so let's go back to the CPAP. How did AAREMS agencies enroll in the CPAP program?
So Mary, you had mentioned to me yesterday that Bob Stuper was no longer the lead man for the BLS CPAP. Is that correct?
That wasn't me you spoke with yesterday about that.
Oh. Okay.
Sorry, Bill.
No, I did speak to you about it, but wait,
No, you talked to me about other matters, not that one.
Oh, okay. Well, we did talk about the BLS CPAP program, but it's very easy to confuse, in my own mind anyway, the BLS CPAP and the intranasal naloxone programs. The intranasal naloxone programs, we have a pathway for approving agencies for that. That's simple. BLS CPAP, then we still go through Bob Stuper, right?
As far as I know, that's true.
Okay.
Our region AAREMS has already approved it. So at that point, once we've approved it, bring it forth to this committee, and then get it approved, medical director to approve it for that agency,
Right.
and then the appropriate training.
Mm-hmm.
And it is still a pilot program, so all data collection must be reported.
Okay.
And send that to your medical director, then who should forward it.
At some point in the early on process, the agency really should get in touch with Bob Stuper and say that we are interested in getting into the program, I would presume, right? Because they're the
You don't have to.
Oh, is that right?
As long as your medical director approves it,
All right.
this committee is aware of it, and you have the appropriate training. And Bob has full PowerPoints. I've got all the copies of Mountain Lake's PowerPoints.
I haven't too. Yeah.
And, yep,
Yeah.
and we have appropriate training. We should be able to go on with it. And
Okay,
as long as
great.
the data gets to your medical director and back to Bob as a pilot.
What started this particular question was an email day before yesterday from Garrettsville. They were interested in getting into the BLS CPAP. Their medical director's all in favor of it, and they just wanted to know how to go about it.
I've had 2 or 3 other inquiries from Otsego County agencies who are interested as well.
Excellent, okay.
The key is making sure that that data gets back so that, we can put that into this pilot program. Currently, I don't think there's a single BLS CPAP use in the state or out of any of the regions that are involved in this. So if in fact agencies are requesting it, they must feel that there is a need in that area. So we need to make sure that that data gets back so that we can report that.
All right, any other new business?
I have paperwork received just this morning from City of Oneonta Fire Department ambulance. This is the BLS naloxone administration program. Brian, perhaps you'd, where are you? There, perhaps you'd care to speak about it?
There's a very slim chance that our BLS providers would have to use it, but in case of
Okay.
big emergencies in the
You
city.
have, I didn't have a chance to read this yet, but you have, I just got it this morning, but you have completed the training then, right?
The training is waiting based on
Oh, I see.
approval.
I see, okay. Okay, so best that would be approval for the City of Oneonta Fire Department ambulance to become part of the BLS naloxone program.
Okay. Any other new business? So we have need for an executive session, is that right?
We do have need for a brief executive session. If I would ask,
Do we need a vote on that naloxone problem?
that would be the physicians, I think they already did.
Oh, you did vote it?
There's a hand, it's
I
handy to
must
have the physicians all situated. There's good eye contact with the physicians, excellent eye contact.
It's the physician mind melt. It's
Just happened so fast that it...
It's
I
right.
started to do research on it.
The Vulcans have nothing on them, they go right to it. Okey-doke. The only correspondence we got was dealing with QI issues, which hopefully we will discuss now.
All right. Adjourn the REMAC.
So actually, we don't adjourn, if I may, Gus, we
All
don't
right.
adjourn until we get
Roberts,
back
yeah,
to
what do I know?
executive session. So-